Medical Notepad, brought to you by Cardiovascular Systems Incorporated's Patient Advocacy Campaign, Take a Stand Against Amputation, and The Way to My Heart.
Dr. George Adams, interventional cardiologist out of Raleigh, North Carolina. I'm with the UNC Rex Hospital System. Today we're going to be talking about stenting, these metallic scaffolds that help keep the vessel open. If there's a blockage in one of the leg vessels, we're able to go in there and blow a balloon up and place a stent. The other stent types include ones that you actually unleash, and they actually are self-flowering. They're self-expanding stents that keep positive pressure on the vessel, as well as stents, these nitinol scaffolds that have drug on it to help prevent this restenosis, this scar formation that occurs over time. And then lastly, there are these covered stents, these stents that actually have a cover on them, and it traps material such that we prop it up against the vessel wall and open up this lumen. What's interesting is in lieu of these stents, there's been a recent change in philosophy in terms of trying to leave nothing behind. The reason for this is that over time, even with these excellent scaffolds, the inflammatory response is enraged. It's activated over time, and you can develop scar formation with these metallic scaffolds. The new philosophy is using devices that have drug on them but leave no metallic scaffold behind. In order to do this, we typically prep the vessel first. We actually rotor-rooter it, as people like to say, or use laser atherectomy, or these balloons that have razor blades or wires that go around it to score the vessel such that it'll open up appropriately with a balloon post. These new novel devices have drug on them, so they're drug-coated or drug-eluting balloons. For the last 5 to 10 years, we've been using drug-coated balloons that have paclitaxel. It's the biologic agent on it to prevent the scar formation. But most recently, much like in the coronaries, the drug we use is something called sirolimus. We're using that same drug now, recently, on a balloon technology, which is now enrolling patients in the United States, and it's under trial investigation. We're very encouraged with this. Also, in the future, there's going to be bioresorbable scaffolds that also have drugs. So these are not metallic scaffolds, but these scaffolds that are made out of agents that absorb over time, so you're not left with the metallic scaffold. This is Dr. George Adams with this week's Medical Notepad.
Remember, the advice and views offered during this series are for informational and educational purposes only. Always ask your own healthcare provider for explicit consent before acting on any information provided here. If you want more information on peripheral artery disease, go to standagainsamputation.com. And for real-time support, go to thewaytomyheart.org.